And what made you decide to come to Sono Bello?
Over the past couple years, I have been working on myself and like my mental stability and my emotional stability. And I think a lot of that like animosity came from my body and how I feel about myself. And I can now confidently say that like I'm at a secure place and to where like even if I didn't get this, I would still, you know, be respectful of myself and respectful of my body and care about myself. But I'm getting this because, you know, it's something that I want. It's a choice. And I really think it'll help me push even more forward with that confidence level. I mean, there are people that, you know, get stuck in one place for so long, they don't think they can move forward. And I just think it's like, well, I can do better than this, than what I'm doing.
So Malaysia came in, her concerns were that she was carrying too much fat all around. So the belly, the waistline, and the back. Because she's young, she was not interested in having a scar. And so after looking at her and this, how great her skin still was, even though she did carry, you know, quite a bit of weight in the torso region, we decided together that liposuction alone would be the best option for her. I'm going to start off by just marking the areas that we're going to be working on today. So I'm just going to lift up your breast with my hand here, come across. All right, so today's procedure, I'm going to be doing the upper, lower abdomen, and then the waistline. And so I just want to show you the markings. So right below the breast, I'm just going to lift this up a little bit, is where we start all the way across. And when you see these lines here, that just means that that's the end of my stomach, this part of the stomach I'm going to do. So this is considered to be the upper abdomen right above the belly button. And then below the belly button is going to be the lower abdomen. Then we start with the front part of your waistline. So that's why you see, go ahead and turn sideways for me. That's why you see this marking here. You can bring your arm, yep. This is the front part of your waistline. And then when we come to the back part, this is the back part of your waist. This is a separate area here. This is actually the back bra roll. And this is considered to be the upper back. So separate areas, what I'm focusing on is the waistline. And go ahead and turn one more time for me. And the abdomen. This is the upper abdomen and this is the lower abdomen. The procedure is going to consist of liposuction of the upper and lower abdomen and the waistline. Do you agree?
I agree.
Yeah. Malaysia, do you agree?
Yeah.
All right.
We're on board. Woohoo!
Malaysia, I'm going to start with the numbing now. You're going to feel a lot of pinching, maybe some burning. When it becomes a little excessive, I want you to focus on taking slow, deep breaths, and you're going to do great. You ready? All right, here we go. Starting the numbing. How do you feel? Pinching?
Yeah.
Yeah, okay. Nothing terrible. Remember, it's only going to last a few seconds and then it'll go away. So during the procedure, what I did was I started off with liposuction to her lower abdomen. That's where I like to start. It's the best place in my opinion. And then I like to move up to the upper part of the abdomen. Once that looks really nice and flat to me and I've extracted all that I can take, I then move on to the waistline. I like to do the waistline from the front in the back position. So you'll see me going to the right side and then over to the left side. Once I love how that looks, I then have her turn onto her side. And that allows me to really get into the waistline to go ahead and snatch that waist. I have some different incision points that I go through and I can really take that fat. So you'll see her on her left side versus her right side. You'll see a nurse help me with the assistance of pulling that skin so that I can get nice, clean, even strokes and pull out as much fat as possible with her help. In addition to that, you'll notice that I try to keep her in a straight position. There is a reason for that. In my experience, I find that when someone is lying perfectly on their side with legs straight and your arm outstretched, that allows me to give you the best snatched waist that you could possibly have from liposuction.
Okay, so this part right here is just like blood and fluid, but all of this is fat. And that's just from your abdomen. She's still working on it, but all of that, so that's about 1,500 of fat, so about 1.5 liters.
What does it feel like?
Like my mom poking me.
So TriSculpt is more innovative than traditional liposuction because we use micro lasers, which allows me to go in and help liquefy any fat that's left, as well as heat up the skin so that we can cause collagen to be produced over the next 3 months. It is pretty quick and very painless, and most patients will sleep right during that end part. And that's the end of the procedure. Then the nurse takes over and puts you into your surgical garment, and you're off home to rest and relax.